My name is Stacy. I'm the student physical therapist going to be working with you today. How are you?
Doing good, thanks. How are you?
I'm great. So today it just looks like we are coming in because you seem to be slowing down when you go out with your husband, correct?
Yes.
Okay, and so we know that you're diagnosed with Parkinson's disease, but you're in stage 1 right now, and so it seems to be affecting your left side more right now. So what we're going to be doing is we're just going to do some tests. We're going to talk about those tests. We're going to see what kind of interventions that can help you today, and then I'll probably send you home with some exercises. How does that sound?
Sounds good.
So the two tests that I choose are gonna be the 10-meter walk test to check for speed because I want to see what her gait speed is. She said that she was slowing down with her husband, and that or her husband has been saying that, and that she isn't getting good quality of her gait, and so I kind of will use my assessment during that gait to see what kind of things are going on. And then also I want to do the MOCA because Parkinson's disease affects their cognition as well, and so I want to see where she is with her cognition because cognition and her physical ability are highly correlated, especially with Parkinson's disease. So want to make sure that she's able to probably talk while she's walking with her husband, and do task while she's moving around, mental tasks while she's moving around and doing dual task activities. After doing her 10-meter walk test, it looks like she has 1.1 meters per second as her gait speed, which is actually quite wonderful. It's almost normal. Normal's within 1.2 to 1.4 meters per second, so she's really not that far off. But the fact that she is slowing down compared to what she normally does is indication that her Parkinson's disease might be progressing a little bit. So we are going to use that to hopefully keep a measurement, and we want to avoid continuous progression from that. And then her MOCA assessment was a score of 30, and so the highest score you can get is a 30, so that's wonderful, and we can also use that as a measurement for our goals to make sure that she's not regressing in her score, which would mean that she's probably progressing in her Parkinson's disease. So what we're going to be doing as far as throughout our therapy sessions is I really want to work on preventing any further progression of your Parkinson's disease. So we're not exactly looking for complete improvement. So if you don't see improvement during your therapy sessions, that's okay. We just want to prevent from regressing more than anything. But if we do see improvement, that's wonderful. We will want to see that too. So the main thing I want to work on is keeping up with your gait speed, making sure that you're taking nice big steps, because with this diagnosis, patients tend to take smaller and smaller steps, and then which can lead to fear of falling or unstable balance and stuff like that. So we want to keep that up and keep working on the big movement. So if you ever have heard of Big and Loud, I'm sure you will hear of it if you haven't from like other providers. So Big and Loud is a very popular program with Parkinson's disease. They like to focus on being very big, and they also focus on being loud with their voice, which also helps get those nerves stimulated again. So we'll do stuff like that, including lunges, because lunges require big movements, continuous walking. We want to make sure that our interventions are high intensity, meaning that I want you to work pretty hard on these because it will definitely help with your diagnosis. Also, we'll be working on your strength. We want to make sure that your muscles are nice and strong so you have the ability to move around a little bit easier and you don't lose that ability. And so we also know in research that improving your strength and working on these high intensity exercises is going to actually benefit you in more ways than one. So what we'll do is we'll start by putting this gait belt on you. Have you ever seen one of these before?
Mhm.
Okay. So this is just gonna go around your waist. It's just for me to kind of help keep you steady if you do tend to trip or anything. But it's mainly to just keep you safe. But let's put this on. You can go ahead and sit down. Yeah, that's okay. All right, we're gonna put this on around your waist. Okay. How's that feeling for you?
You're squeezing the life out of me.
So first we're going to start with this exercise. This is going to be kind of similar to what they would do in the Big and Loud program. So again, like I mentioned, they want big movements and they want you to kind of be very verbal and loud because this is what has been proven in research to be beneficial for Parkinson's patients. So we're just going to start with your hands on your hips. I'll show you first and then I'll have you do it, okay? So you're going to start with your hands on your hips and you're just going to step out to the side. And you're gonna kind of bend your knee a little bit, and then you're gonna step back, and then you're gonna step out to the other side and kind of bend your knee a little bit and step back. And the goal right here is to just kind of work on getting as big of steps as you can. And I'm just gonna be right behind you to make sure that you're safe, okay? So let's have you do that first. We'll try that real quick. Okay, step to the right. Yep, good. And then step to the left. Good. And go in. Good. And then to the left. All right, so now what I want you to do is you're gonna yell out the number that you're on. So when you step to the right, you're gonna go 1 really loud, okay? And then you go to the left and you're gonna say you're gonna say 2, okay? We're gonna do that a couple times. Ready? And I'll yell with you. Okay, and to the right, go 1, 2, 3, one more, 4. Okay. And so what I would do is I would kind of monitor by seeing how heavy he's breathing. We definitely want him to be breathing pretty heavy and working really hard because, again, like I said, the high intensity is very important for these patients. So I can use an RPE scale, say, okay, there's a scale on 1 to 10, well, I guess with these patients, if their cognition is becoming impaired, I can use a 1 to 10 scale, but we can use the normal Berg RPE scale, and I can get a print out of that so he can point to what number he feels like he's working. I could also do vitals depending on what the patient's vitals were during the initial visit. If they seem like they were elevated, especially because she seems to be leaning towards the elderly years, vitals would be a good option. But I want to make sure that she's feeling like she's working hard without pushing her too far. And so I want her to probably start with maybe 10 on each side. And then I would move to the going forward and back, which is what we're going to do real quick. And so going forward and back, I would have her put her hands on her hips, or him. I would have him put his hands on his hips, and he can step forward as far as he can, and keep doing that. And another way we can do it is going backwards. Backwards may be a little bit more difficult for the older patients because they're scared of falling if they've had any falls. But again, I will continue to guard them. And so the goal is to keep going further and further back. As far as progression, I could have them just take smaller steps for both sideways and forwards and backs. If they feel like it's too difficult for them, regression, not progression. And to progress the exercise, I eventually want them to start doing big arm movements as well, getting nice big arms out, and then going forward, reaching forward with the opposite arm, just like this, and same with going backwards, reaching back with the opposite arm and forward. And then to progress it even harder, because she does seem to be pretty physically active going on her evening walks and that she's not very impaired, I can actually have her stepping over obstacles and going forward and stepping over obstacles, going backwards and stepping over. So yeah, I think we would continue to do that for starter intervention.